Hello, my name is Aimee Thorne-Thomsen. I'm the Acting Executive Director of SisterSong, Women of Color Reproductive Justice Collective, based in Atlanta, Georgia. We are a Southern-based national organization working to amplify and strengthen the collective voices of Indigenous women and women of color to ensure reproductive justice through securing human rights for all of us, but most especially for women and girls of color. I am outraged that at a time when people's health and lives and even their livelihoods are under threat as a result of the COVID-19 pandemic, that there are lawmakers playing political games with our bodily autonomy. This is certainly not the first time that we've seen this, and it probably won't be the last. For more than 20 years, SisterSong has been a forceful and fierce advocate on behalf of the ability of women and pregnant people and people of color to make our own decisions about our bodies, our families, and our futures. We know that the brunt of this pandemic will likely fall hardest on those struggling to make ends meet already, and those who have been failed by our health system, especially women and people of color. Our state and federal leaders should be focused on our families' health and safety and financial security first and foremost. It's shameful that anyone would use this national crisis, this global crisis, to try to deny critical health care to our communities. Abortion is essential health care. Let me say that again. Abortion is essential health care. We need to speak up and speak out about any attempts to put up more obstacles and barriers in the way of people accessing the services they need. But more than that, we need to truly show up for our communities. We need to call and text and fax and email and tweet, whatever you can do to raise a rallying cry to ensure that whether someone chooses to parent and add to their family, to put a child up for adoption, or to seek an abortion, that they can get safe, compassionate care. Join us in urging governors, health departments, and state lawmakers to do more to meet the full range of needs of women of color in our communities. We need to get rid of state and federal policies that deny health care coverage for abortion and other key reproductive services. We must get rid of bans on the use of telemedicine for abortion and stop forced ultrasounds and waiting periods. We need to stop requiring multiple and many times unnecessary visits to doctors' offices and make sure counseling can be done through telehealth as much as possible. We need to make abortion pills available by mail, period. We cannot allow any investigations for people who self-manage their own abortions. And finally, we need to urge the FDA to lift restrictions on doctors prescribing mifepristone, a key component of medication abortion. Listen. What we need right now is paid sick leave, fair wages, and a healthcare system that works for all of us. What we don't need are any more attempts to push abortion care out of the reach of people in order to advance a political agenda. Abortion is essential healthcare, period.